How many more are there to draw, to fill in? 3 more. You just take all 3. If they're all equal scores. Yes, please test the bell. Yes. Okay, we've moved the view of the judges and the quizmaster so that we can see everybody correctly. Okay, are you ready? Yeah. Okay, your question is, I'll give you four possible answers, so you have to just choose. Okay. So your question is, how many different types of odors, O-D-O-R-S, smell odors, can be discriminated by the olfactory system? And the answers given are about 500, about 1,000, about 5,000, and more than 10,000. Okay, let me repeat. How many different types of odors, O-D-O-R-S, can be discriminated by the olfactory system? About 500, about 1,000, about 5,000, and more than 10,000.
Sorry, this one I only choose one, right?
Choose one.
I think it's more than 10,000.
That's correct. So that's quite incredible system here. Okay, your question is, UGM, in chronic pulmonary disease, what sensory receptor mechanism results in the breathing to be sustained instead by a hypoxic drive? In chronic pulmonary disease, what sensory receptor mechanism results in the breathing to be sustained instead by a hypoxic drive?
Chronic hypercapnia because of the adaptations of sensory receptors to the adaptations of chemoreceptors.
That's correct. So the normal drive is actually a hypercapnic drive, but because of chronic hypercapnia, there's sensory adaptation here. Okay. Third question: in renal failure, elevated plasma urea is also due to a change in urea transport at the proximal convoluted tubule. Briefly explain. In renal failure, elevated plasma urea is also due to a change in the urea transport at the proximal convoluted tubule. Very briefly explain. Yes.
In renal failure, there will be a decrease in the GFR, so there will be an increase in water reabsorptions, and this drives an increased reabsorptions in urea that causes an increase in plasma urea concentrations.
That's correct. Fourth question in this first cycle: what are the 2 sites of greatest drop in blood pressure along the renal circulation? Where are the 2 sites of the greatest drop in blood pressure along the renal circulation? State very briefly the reason.
At the efferent arterioles.
Okay. One more.
Peritubular capillaries.
Sorry, peritubular answer is wrong. Yes.
It's the afferent and efferent arteriole because it's where the resistance increases most, so there will be a drop in pressure most also.
That's correct. Okay, I think so. One last team is slightly faster. Yeah. Okay, you just check the bells. All right. Your question, UI, is during exercise, what two vascular events lower the pulmonary vascular resistance in order to sustain the increased right ventricular cardiac output? During exercise, what two vascular events lower the pulmonary vascular resistance in order to sustain the increased right ventricular cardiac output?
Yes, thank you. In the exercise, there is increase in cardiac output to the lungs. It makes the vasodilation because of the mechanical action, and also increase in recruitment of vascular in the pulmonary.
That's correct. Okay. Do you like to eat chocolate?
Yes.
Okay, this question is for you. Yeah. When you are eating a piece of chocolate in your mouth, even before glucose is produced, what stimulates some secretion of insulin? When you are eating a piece of chocolate in your mouth, even before glucose is produced, what stimulates some secretion of insulin?
Because I think about chocolate, so that it will induce from my brain will induce some cephalic reflex to increase insulin.
Be more specific. Cephalic reflex.
Cephalic reflex that induce induce secretion of insulin to prepare chocolate before we.
How does the cephalic reflex release the insulin?
It's from parasympathetic nerve activity that.
That's correct. Yeah.
Induce.
Okay, your question. The last cell is when GFR, glomerular filtration rate, acutely increases, state the change in the two Starling forces at the peritubular capillary that helps to compensate. When the GFR acutely increases, state the change to the two Starling forces at the peritubular capillary that helps to compensate.
When an increase in GFR occurs, more fluid is filtered into the Bowman space, thereby increasing oncotic pressure by means of concentration. The increased oncotic pressure in the glomerular capillaries then enter the afferent arterioles to the peritubular capillaries, and this promotes reabsorption of tubular fluid. Also, increase in filtered load increases tubular hydrostatic pressure, driving reabsorption.
Sorry, the second one again. Increase in GFR, what does it do to the hydrostatic pressure?
Increase in GFR increases tubular fluid hydrostatic pressure, which drives reabsorption of tubular fluid.
So the hydrostatic pressure you mentioned in the peritubular is increased? Decrease.
In the peritubular.
Decrease.
Decrease.
That's correct, yeah. Okay, fourth question, second cycle. Which cardiac muscle enzyme may be affected in Which cardiac muscle enzyme may be affected in hyperthyroidism to account for the increased ejection fraction? Which cardiac muscle enzyme may be affected in hyperthyroidism to account for the increased ejection fraction?
ATPS?
More specific?
Sodium potassium ATPS?
Answer is wrong.
I think myosin ATPase.
That's correct. Okay, last cycle of 4 questions. Okay, you ready? Yep. UI, your question is, in some situation of male infertility, the low sperm count is associated with the high levels of a major pituitary hormone. Briefly explain. In some situation of male infertility, the low sperm count is associated with high levels of a major pituitary hormone. Briefly explain.
Okay, so from what I got is that the levels of FSH and LH is quite high. It is because of the reduced inhibition by the hormone that are produced in the testes. What I think is about the testosterone. There's a deficiency of testosterone, which and also testosterone because it has a feedback. It has a feedback mechanism to decrease the FSH and LH.
So you're saying that low testosterone cause the high FSH, is that what you're saying?
There may be defect in the testosterone. There may be a defect in the in the cells that are producing testosterone in the testes.
Okay. Yeah, so the judges would like you to, the low testosterone is okay, but can you name the low level of another hormone?
Inhibin?
That's correct, yeah. Okay, that is probably the more major reason, okay. Okay, second question to UGM. Yeah. During stagnant hypoxia, two things here. During stagnant hypoxia, state the change, if any, in the venous blood, two things, partial pressure of oxygen, and two, the hemoglobin oxygen saturation. I repeat, during stagnant hypoxia, state the change, if any, in the venous blood of partial pressure of oxygen, and two, the hemoglobin oxygen saturation.
So, in stagnant hypoxia, there is a decreased blood flow. The decreased blood flow would decrease the partial pressure of oxygen in venous blood. And about the second question, the hemoglobin saturation of oxygen will be decreased because of a decrease in partial pressure of oxygen.
That's correct, yeah. Question to Dalasel, name the specific type and location of the neurotransmitter receptor that mediates bradycardia. Name the specific type and location of neurotransmitter receptor that mediates bradycardia.
M2 receptors on sinoatrial node.
On what, sorry?
Sinoatrial node.
That's correct, yeah. Okay, last question in this first quarterfinal session to Pradenia. State with reasons what effect, if any, atropine would have on gastric histamine release. State with reasons what effect, if any, atropine would have on gastric histamine release. Okay, we'll take it. Okay, that's it.
Atropine will decrease the histamine release from
Will-
ECL cells because it inhibits the activation of ECL cells by acetylcholine.
Okay, that's correct. Yeah. Yes, the parasympathetic releases acetylcholine to the ECL cells. Yeah. Okay, the winning team from here is UGM, and then we will decide on the other three teams to join them. Yeah. Okay. Thank you very much.